Every day, your body wages war with enemies that are silent and unseen but potentially deadly. Viruses, parasites, bacteria, and even changes within your own body may threaten your health. You may not be aware of these struggles or battles because your immune system repels and or destroys these foreign invaders before the onset of symptoms. But sometimes, these agents may gain the upper hand. If so, you may need to bolster your immune or defense with medication and other treatments. For thousands of years, for example, people virtually knew nothing about microorganisms or other small organisms that might be potentially harmful. But when the 19th century scientists confirmed the link between germ and disease, we became better equipped to defend ourselves. Medical researchers have since eliminated or greatly reduced the threats of some of these diseases, including smallpox and polio. Polio shouldn't even be occurring because it's vaccinatable or immunizable. But care should be taken when dealing with these vaccines when it comes to pregnant women and immunocompromised patients. Why? For example, administration of a live attenuated polio vaccine, BCG vaccine, and Salmonella typhi vaccine, they can potentially cause infection in such patients or cause disease in such patients. However, recently, some have made a comeback, such as dengue and yellow fever. But why? Consider the following factors. Every year, millions of people travel around the globe transporting disease-causing agents, according to an article in a Journal of Clinical Infectious Disease. Virtually, all contagious and virulent infections can be spread by international travelers. Some bacteria have developed resistance to antimicrobials or antibiotics. For example, MRSA and vancomycin-resistant enterococcus. According to the WHO, we are heading to a post-antibiotic era in which common infections can once again kill. Civil unrest, poverty have hindered the government's efforts in trying to control the spread of disease. Modern foods, changing lifestyle, climatic change, environmental pollution, and even our fellow human beings have led to or have contributed to emergence of new diseases. People virtually lack knowledge or practical knowledge of how to protect themselves or to prevent disease. Despite these disturbing trends, there's much you can do to protect yourself and your family from disease. Even if you live in a developing land, you'll find that simple, practical, and appropriate strategies are within your reach. Many ancient cities were protected by massive walls. If an enemy just breached a section of these walls, the entire city could be at risk. Your body is likened to these walls. How you take care of your defense depends on how healthy you are. So let's explore these elements and see how you can put up the best possible defenses.